Hi guys, today urine pregnancy tests. How do they work? Are they accurate? What's the main difference between all those types? And most importantly, should emergency services use them or just rely on the blood tests? So many questions and only 4 minutes, so let's get started. To understand how the pregnancy test works, firstly, we need to go through the physiology of the menstrual cycle. It's quite important because apparently there's still not enough education on this subject around the world. So regardless of where you are working as a clinician, you should be firstly ready to discuss menstrual cycle with your patient to make sure that they are aware what's going on. Now, the menstrual cycle is approximately 28 days long. It starts with the bleeding phase, which lasts for approximately 3 days. Uterus contracts and gets rid of unused lining. Then, halfway through the cycle, an ovulation occurs. So the woman's body develops an egg that can be fertilized. The ovulation can occur a day earlier or day later, and we also know that sperm can live up to 5 days in a woman's body. Knowing all that, we assume that 5 days in the middle of the cycle are so-called fertile days. So your patient may get pregnant if they will have an unprotected sex during those days. Fertilized egg travels up the fallopian tube up to the uterus where it will implant. This journey takes approximately 6 to 8 days. Now, the implantation of an egg into the uterus wall is not a nice and gentle process. In the matter of fact, it's almost like a comet hitting the earth. It's so violent process that some minor vessels on the uterus wall may get ruptured and your patient may experience spotting or even minor bleeding. No ma'am, it is not an early period. It is bleeding from implantation. Anyway, from the moment of the implantation, we may think about detection of the pregnancy. Why? Because after an implantation, body will release a hormone called HCG or beta HCG. It normally doubles its quantity every single day to reach a peak of between 8th and 10th week of the pregnancy and then slowly decreases. So now we can talk about pregnancy tests. All your patient needs to do is either dip it in the pot with urine or just simply wee on it. If HCG hormone is present in the urine, the chemical reaction will make 2 strips visible. If there's no HCG in urine, only 1 strip, so-called control strip, will appear. Boom! Now let's talk about numbers. Standard or budget pregnancy test is sensitive of 25 milli international units per milliliter. It means that it can detect pregnancy approximately 2 days before the expected period. A bit more sensitive and advanced test, it's sensitive on 10 milli international units per milliliter, so it's 5 to 6 days before the expected period. The most sensitive test I found on the market is the American First Response Test. Sensitivity 6 milli international units per milliliter, so it should be able to detect pregnancy even a week before the expected period. Does it mean that the most sensitive test is the best? Not necessarily, because you may get lots of false positive outcomes, especially if your patient is on certain meds. For example, if your patient is trying to conceive, they can be on so-called beta HCG boosters like Novarel or Pregnil, which may give you false positive result. Also, you may see false positive results in patients on antipsychotic meds based on phenothiazine, like chlorpromazine or promazine, and even patients on anti-acne meds. Also be aware that beta HCG levels stay high in your patient's body up to 4 weeks. So in theory, you may see a false positive test in patients who miscarried or had termination of pregnancy. And last but not least, it can be just due to the manufacturer errors, and I've seen things like that. What about false negatives? Yeah, they can happen. Hormones are very tricky things. I've seen a patient with extremely low beta-HCG levels. Actually, she had the first positive pregnancy test 4 weeks after the date of missed period. The next thing you have to be aware is time when you actually perform a test. So especially in the early pregnancy, high beta-HCG levels will be in the morning urine. So if you will perform tests, let's say in the afternoon, HCG levels can be low and not detected by the test. So you will get a false negative result. Now, last thing, the positive result of the test can be either devastating for your patient or give a false hope. So be tactful when passing the information to your patient and make sure that they are aware of false positives and false negatives. That's it, guys. I hope you liked this video. If so, please leave me thumbs up and subscribe to the channel, or just simply go to www.groupcall.uk for more videos. My name is Alex Hepner and this was Group Call.